So our 3D printing lab started essentially 8 years ago when we had a set of conjoined twins that needed to be separated, and we did two more sets of conjoined twins since that time. But the anatomy was really complex and difficult to understand through just the cross-sectional imaging. So our surgeons were really the ones to request a physical model, and they requested a liver, which ended up being really helpful for several reasons. One, it was life size, and two, it allowed them to talk amongst themselves in a multidisciplinary manner, using the model as a physical object to all discuss the same thing about what the steps were going to be. And from doing that set of conjoined twins to something that was really complex, we then migrated into different areas where the clinicians and surgeons thought that it would be helpful. The trouble with just having a three-dimensional object on a two-dimensional screen is it's still two-dimensional. And it depends on the size of the screen that you're displaying it on. It depends on the size of the object. So if you're presenting a skull of a 2-year-old and an 82-year-old, they're the same size on the screen. So you don't have any sense of scale. And so one of the benefits that was immediately apparent in 3D printing was that size. That things are true to life size, and it was a physical object that you could hold in your hands and rotate. Because some of perception comes from visual, but a lot of perception comes through touch, although you're not aware of it, because we live in the physical world. We work with three-dimensional objects all day, that your brain doesn't have to come up with how big is something, what size is that, from a collection of axial images, for example. You just look at it and know what size it is, and you can think about it. The same thing happens in surgery. Surgeons can stop looking at the radiographic images and trying to compile what this image looks like in real space and how they're going to operate on it, where they can just hold the model in their hand and turn it and rotate it and have a sense of how they're going to put the patient on the table, where can they make their cuts, can they make different cuts that they didn't think were previously possible, because now they have a three-dimensional life-size object that's patient-specific. It's not any pelvis or any spine, it's the patient that they're going to be operating on. The surgical specialties. Anytime where there's multiple disciplines that need to be brought in to develop a complex problem, whether it's a complex tumor resection or a complex anastomosis or complex anatomy that maybe has been previously operated on, the models are helpful because within the surgical disciplines, they all don't speak the same language. It allows them to talk in common terms around the model about simple things like, I will do this, then we need someone to do this. How can we put the patient on the table to get all this accomplished? And then also, how can we prep the OR team? Thoracic surgery has been growing incrementally through Chandra Blackman and Steve Cassivi and Dennis Weigel. So we're developing new ways to take out tumors through less invasive means so that the larger surgeries don't have to be done. One of the side benefits of having 3D printed models is the patient also gets to view the model, and it allows them to have a more informed consent. So typically what we do is we look at images on a computer screen and we try and tell the patient what the MRI or the CT scan shows, but it's really difficult for doctors even to understand the CT, the MRI, let alone the patient who doesn't have any medical knowledge at all, that we spend a lot of time saying which side we're on and where we are in the body. Whereas if you give the patient a model, it allows them to physically hold their own bones, for example, outside their body, but it allows them also to understand why the surgeon might have to cut somewhere or what some of the risks are, what are the benefits are. So if you took something complex like this model here, this is a congenital scoliosis cases, which is complex. You can see the ribs are malformed on one side. You can see that the spinal cord is coming out through the side. This is a complex thing to try and fix, but it's also a very complex thing to try and describe to the parents. So if you're describing to the parents how you're going to fix this, it's difficult enough for the physician to understand what this shows. But then to try and relay that to a layperson is very difficult, whereas this becomes very easy to understand because you can hold it up to the patient and say, this is your son, this is your daughter, this is their spine, this is what's on the inside, and this is why we're going to have to do the things we're going to do to try and repair this. And I think having the patient understand what we're going to do to them is really important, particularly in cancer surgeries, pediatric surgeries, or any surgery for that matter. We haven't proved it reduces patient anxiety in a study, but it clearly increases their understanding of their own disease process. And we've had patients who have really bad tumors be incredibly excited when we show them the model and they post the model on Facebook and they kind of can't believe that someone went to this length to help solve their problem or help deal with their disease. And it's incredible sometimes you see someone who has a really serious problem facing them, and we show them the model, show them their tumor, and they get really excited. The other place it's helped is in the craniomaxillofacial and orthopedic realm when we create custom 3D printed cutting guides. So these are guides that are made based on the patient's anatomy. We create a guide, a surgical guide, that is screwed onto the bone that then allows the surgeon to make very precise cuts that were planned ahead of time on the computer. That wouldn't be possible without 3D printing because we're designing the guides using the patient's body, using the patient's bones, and from their CT scan allows us to make a patient-specific guide that can be screwed on the patient's bone, whether it's the maxilla or the mandible or a leg bone, that it allows them to make very precise cuts planned ahead of time, which is reducing the amount of time in the OR and increasing the precision. One of the things we'd like to improve is the ability of printers to make materials that actually print like physical objects, that they feel like a kidney, they feel like a liver, they can feel like small bowel. Therefore, you can make simulation models that are more robust. Currently, we're doing simulation models that are patient-specific for aortic grafts, so patients who have complex aortic surgeries they need to have, or complex aortic custom stents built because they have a problem, that we can build simulation models that are hooked up to flow pumps, and that the surgeon can do the entire case on the simulation model that's patient-specific, and then go into the next room sometimes right after and do it on the patient. So the field of simulation continues to grow. I think as the materials get better, the printers get faster. Currently, it can take up to 3 days sometimes to print a really large pelvic tumor model of an adult. As the materials get better, the printers get faster, and the cost comes down. I think it'll be easier to integrate it into all our care.